name is Troy, and I did a systematic review on the adherence to the MIND diet and its effects on depression symptoms in adults. My research question was, in adults aged 18 years and older, does adhering to the MIND diet over a period of 1 to 13 years reduce depression compared to adults aged 18 years and older not adhering to the MIND diet? To give you a little history of the MIND diet, it was created in 2015 by Dr. Martha Claire Morris as a combination of the DASH and the Mediterranean diets. And it was initially developed to help preserve brain health. In Dr. Morris's initial study, she published her findings on the creation of the MIND diet as well as the creation of the MIND diet score, and found that it significantly helped reduce the prevalence of dementia in older adults. The central components of the MIND diet are broken up into 10 brain healthy foods and 5 brain unhealthy foods. The 10 brain healthy foods include green leafy vegetables, other types of vegetables, berries, nuts, olive oil, whole grains, fish, beans, poultry that is not fried, and wine, particularly red wine. And the brain unhealthy foods include butter or margarine, cheese, red meats, fried foods, and pastries and sweets. When we talk about the MIND diet score, it's scored on a total of 15 points. For the 10 brain healthy foods, a score of 1 is the highest score, which would indicate that an individual is consuming the most servings per week of these brain healthy foods. Except for olive oil. Olive oil is a little bit special because it's only assigned a score of 0 or 1. 0 meaning that it's not the primary cooking oil used, and 1 meaning that it is the primary cooking oil used. For the 5 brain unhealthy foods, on the other hand, a score of 1 would mean that an individual is consuming the least amount of these foods. The 10 categories of brain healthy foods contain several different types of bioactive compounds that are thought to play a role in both inflammation and helping lessen depressive symptoms. Berries and red wine contain anthocyanins. Green leafy vegetables, whole grains, beans, legumes, and poultry contain a variety of B vitamins. Green leafy vegetables and other types of vegetables, including carrots, contain carotenoids. Green leafy vegetables, other types of vegetables, berries, beans, legumes, and wine contain flavonoids. Red wine in particular contains resveratrol. Nuts and whole grains contain magnesium. Extra virgin olive oil has a few compounds to note, including oleocanthal, hydroxytyrosol, oleopene, and oleic acid. Nuts and fish, especially fatty fish, contain omega-3 fatty acids that include both EPA and DHA. Other vegetables, berries, whole grains, beans, and legumes contain phenolic acids. Nuts, beans, legumes, and wine contain polyphenols. Beans, legumes, and poultry contain amino acids, particularly the amino acid tryptophan. Other vegetables contain vitamin C. Fish is a good source of vitamin D. Green leafy vegetables and nuts are a good source of vitamin E. And vitamin K is mostly found in your green leafy vegetables. Major depression is caused by a variety of different factors that contribute to oxidative stress and inflammation in the brain, namely A variety of increased pro-inflammatory cytokines are found in the brain of depressed patients, as well as reduced neurotransmitter receptors function and reduced neurotrophic factors. Several inflammatory biomarkers for depression include the interleukin family, several different chemokines, interferons, transforming growth factor beta, soluble tumor necrosis factor receptors, neopterin, and the kynurenine pathway metabolites. The IDO-kynurenine pathway is thought to play a significant role in tryptophan metabolism, which results in a decrease of tryptophan in the brain, resulting in an overproduction of quinolinic acid, which contributes to neurotoxic effects, including depression. Environmental stress stimulates the production of several pro-inflammatory cytokines, and this production of pro-inflammatory cytokines activates the NF-κB pathway. And then the NF-κB pathway, in turn, overproduces several inflammatory cytokines, chemokines, and adhesion molecules, all of which are thought to contribute to depression. Sirtuin-1 is a regulatory enzyme that actually inhibits the NF-κB pathway, which in turn reduces the proliferation of inflammatory cytokines and chemokines. Another major pathway thought to contribute to depression is the NLRP3 and caspase-1 pathway, both of which are involved in stress and depression. The inflammatory cytokines stimulated by NF-κB activate the NLRP3 pathway, which in turn stimulates multiple inflammasomes, which results in caspase-1. And caspase-1 then stimulates the production of several inflammatory biomarkers, including tumor necrosis factor alpha, interleukin-1 alpha, and C1q. Arachidonic acid is a type of omega-6 fatty acid, and omega-6 fatty acids do contribute to inflammation within the brain. Omega-6 fatty acids do get metabolized through the arachidonic acid cycle, and once they go through the arachidonic acid cycle, they result in the production of prostaglandins and COX genes, both of which contribute to inflammation within the brain. Finally, the IKB kinase complex is also another pathway that contributes to inflammation and cell death, and it works by stimulating the production of the NF-κB pathway, which, as we learned earlier, stimulates the production of multiple inflammatory chemokines and cytokines that promote inflammation and contribute to cell death. Here's an overview of the eligibility of the included studies in my review. The inclusion criteria included studies that examined the adherence to the MIND diet among adults aged 18 years and older over a period of 1 to 13 years. And they were studies that were written only in English, and studies had to have been published in 2018 or later. They could have included randomized controlled trials, prospective and retrospective cohort studies, and longitudinal studies. Excluded criteria are any studies that involve participants under the age of 18 years old, studies that didn't undergo peer review, studies not involving the MIND diet, studies outside the range of 1 to 13 years, studies not published in English, and studies published before 2018. To conduct the research, I search publications published in 2018 all the way up through 2025 in PubMed, PubMed Central, and ProQuest Central. All the citations that were identified through the search were imported into Zotero, and the duplicates were removed, and then I screened the remaining titles and abstracts of the remaining records for eligibility. And then the full text of potentially relevant articles was retrieved and assessed for inclusion by me. I also did a risk and bias assessment of each included study that was assessed by using the Academy of Nutrition and Dietetics Evidence Analysis Library Quality Criteria Checklist for research studies. To do this literature review, I searched a variety of databases, including PubMed and ProQuest Central, and I searched for studies that were published between 2018 and 2025, and I manually screened these reference lists for studies on the MIND diet and depression. I then screened the titles, abstracts, and the full text for inclusions after the duplicates were removed using Zotero. I also assessed the quality and risk of bias using the Academy of Nutrition and Dietetics Quality Criteria Checklist. Here is an overview of my study selection process. It resulted ultimately in 12 different studies that I was able to include in the review. 6 of the included studies were cross-sectional studies, and the duration of these cross-sectional studies range from 1 to 3 years, and they all studied the outcome of depression symptoms in adults age 18 years or older. The other 6 studies included in my review were prospective cohort studies, and they range in duration from 2 years to as long as 13 years. And the study by Frazan et al. 2018 actually included a very large sample size of 15,980 adults. Each of these studies examined the primary outcome of recurrent or incident depression. The risk of bias assessment resulted in 5 different studies being given a grade of 2, and the other 7 studies being given a grade of 3. Only 3 out of the 12 studies were given a quality rating of positive, with the other 9 remaining studies given a quality rating of neutral. Overall, this risk of bias assessment means that most of the studies had inconclusive findings, and some of the studies had some risk of bias within them. Across all 12 studies, there was a total of 43,823 participants. The sample size varied considerably across all the studies, ranging from as little as 86 participants to as much as 15,980 participants. The age of the participants also ranged considerably from 18 years old all the way up to 90 years old. 3 studies focused exclusively on the elderly population, defined as those aged 65 years and older. As far as gender distribution goes, 1 study included only women, and several others were predominantly female. 4 of the studies had a majority of male participants, and 1 study did not report any gender data. Across all the studies, there was a wide variety of health conditions. Some studies included generally healthy adults, while others included those who had specific health conditions, including Parkinson's disease, stroke, obesity, diabetes, hypertension, cardiovascular disease, hyperlipidemia, and kidney disease. Among the cross-sectional studies included in the review, 2 of them did find a productive association between the MIND diet and lower risks of depression, anxiety, and stress. Within overweight and obese populations, studies included yielded inconsistent results, with 1 finding no significant association between the MIND diet adherence and depression, and another finding no significant association with the severity of depression. One study that looked at a cohort of people who had Parkinson's disease did show that a higher MindDiet score was significantly correlated with reduced severity of non-motor symptoms, which included depression, and it did show that each point on the MindDiet scale was twice as effective as a point on the Mediterranean diet scale in reducing overall depression severity. A high-risk cohort study involving older Spanish adults with overweight and obesity also found a higher adherence to the MindDiet was significantly associated with decreased depression. Among the prospective cohort studies, 2 of them reported a beneficial effect of the MindDiet on depression involving middle-aged and older adults. And in another prospective cohort study involving younger Spanish university graduates, it didn't find any significant association between the adherence to the MindDiet and risk of incident depression. And one other prospective cohort study that involved a cohort of post-stroke survivors, adherence to the MindDiet was not significantly associated with depressive symptoms over time, but the study did find that a Western diet was associated with an increase in post-stroke depressive symptoms. Among the different cross-sectional studies, those that involved healthy adults did show a protective association between the MindDiet and a lower risk of depression. Studies that involved overweight and obese adults found inconsistent results regarding the association between the MindDiet adherence and depression. In those studies involving participants who had Parkinson's disease, a higher MindDiet score was correlated with reduced severity of depression. And in other cross-sectional studies that involved other high-risk older adults, higher adherence to the MindDiet was significantly associated with decreased depression. Among the prospective cohort studies, those that involved middle-aged and older adults found beneficial effect on depression, with higher adherence linked to lower odds of recurring depressive symptoms and fewer depressive symptoms over time. Prospective cohort studies in younger adults found no significant association between the MindDiet and the risk of incident depression, and one of the prospective cohort studies involving post-stroke survivors found that adherence to the MindDiet was not significantly associated with depressive symptoms. Overall, this review found that the evidence of the MindDiet and its ability to improve depression is mixed. Some of the studies did find that the MindDiet reduces depression risk, but then on the same hand, others found no significant effect. It does seem that the MindDiet is most helpful for middle-aged and older adults, but it doesn't seem like the MindDiet has any significant benefit to those seen in younger adults. The MindDiet as well shows a protective effect for people with Parkinson's disease and metabolic syndrome, but not necessarily for post-stroke survivors. Results were inconsistent for those with obesity as well. Overall, going back to the research quality, the quality of the studies were low to moderate, and there were major issues of the studies that included poor study design, reliance on self-reported food diaries, as well as a lack of diversity within the populations. Now let's discuss how all of the different bioactive compounds found in the 10 healthy brain foods within the MindDiet help to actually decrease inflammation and help alleviate depression. And we will start with flavonoids. One specific flavonoid, anthocyanins, which are found mostly in berries, inhibits the NLRP3 inflammasome activation, which in turn inhibits the NF-κB3 pathway and decreases the production of pro-inflammatory compounds, including caspase-1, interleukin-18, and interleukin-1 beta. flavonoids also decrease inflammatory cytokines and mediators, and they also decrease tumor necrosis factor alpha, resveratrol also is another anti-inflammatory flavonoid, and the way that resveratrol helps decrease depression is by decreasing activation of the NF-κB pathway, decreasing levels of tumor necrosis factor alpha, decreasing factors of interleukin-1 beta, and also by inhibiting the NLRP3 pathway. Resveratrol also helps to increase the production of serotonin and dopamine, as well as brain-derived neurotrophic factor, all of which help alleviate symptoms of depression. Quercetin is another specific flavonoid that helps to reduce oxidative stress by ultimately reducing production of nitric oxide. It also helps to reduce inflammation by decreasing production of tumor necrosis factor alpha, interleukin-1 beta, interleukin-6, and it also decreases the production of the COX genes and decreases the activation of the NLRP3 and NF-κB pathways. The different compounds found in olive oil also help to reduce inflammation. One of these compounds, called oleocanthal, has antioxidant activity, and it helps to scavenge the reactive oxygen species. It also acts as a NSAID, sort of in the same way ibuprofen does, by inhibiting the production of the COX-1 and COX-2 genes, and ultimately reducing the synthesis of prostaglandins, which all contribute to inflammation. It also inhibits the biosynthesis of 5-LOX and the pro-inflammatory leukotrienes. Omega-3 fatty acids, including EPA and DHA, both act as inhibitors of pro-inflammatory cytokines, including the inhibition of tumor necrosis factor alpha and interleukin-6, which in turn inhibits the pathway of the NF-κB pathway, which helps to reduce the activation of microglial cell activation. DHA in particular results in the production of resolvins, which in turn results in M2 microglial polarization, which has neuroprotective factors. And EPA in particular competes with arachidonic acid, or omega-6, as mentioned earlier. And this in turn helps to reduce the production of different types of COX genes that play a role in inflammation and depression. Carotenoids also act as a scavenger of reactive oxygen species, and by scavenging reactive oxygen species, it prevents the stimulation of the NF-κB pathway, which in turn prevents the stimulation and proliferation of many different pro-inflammatory cytokines, including interleukin-8, COX-2, and tumor necrosis factor alpha. Both vitamin C and vitamin E play a dual role in antioxidant activity. Vitamin C actually donates an electron that neutralizes the vitamin E radical, which helps to reduce pro-inflammatory cytokines. As mentioned in the previous slide, vitamin C donates an electron to vitamin E, which results in producing its active form, and then the active form of vitamin E helps stop lipid peroxidation, which results in anti-inflammatory activities, and stops the genetic expression of inflammatory cytokines. Vitamin K, which is found mostly in your green leafy vegetables, inhibits the IKK alpha beta complex, and by doing this, it actually prevents the proliferation and stimulation of the NF-κB pathway, which overall results in less inflammation and greater immunity. B vitamins play a significant role in regulating the pro-inflammatory gene expression. And in this example, folate is a B vitamin that plays an anti-inflammatory role. And folate helps to convert homocysteine back into methionine, which then results in a compound called SAM. And SAM helps regulate and prevent the expression of pro-inflammatory genes. Magnesium, which is abundantly found in green leafy vegetables and legumes, as well as beans, help regulate NLRP3 activation. So people who have magnesium deficiency, this actually results in an influx of calcium ions, which then activate the microglia, and then the activation of the microglia in turn results in the activation of the NF-κB pathway, stimulating pro-inflammatory cytokines like tumor necrosis factor alpha, interleukin-6, and nitric oxide. And so by eating foods that are high in magnesium, this will prevent microglial activation and prevent the proliferation and stimulation of the NF-κB pathway, thus reducing pro-inflammatory markers such as tumor necrosis factor alpha, interleukin-6, and nitric oxide. Phenolic acids, which are a type of polyphenol, also play a role in reducing symptoms of depression. In this example, ferulic acid is a type of phenolic acid, which inhibits microglial activation and in turn inhibits production of pro-inflammatory cytokines, including interleukin-1 beta, interleukin-6, and tumor necrosis factor alpha. And it also helps reduce the activation of the NLRP3 pathway. Circling back to the metabolism of tryptophan, tryptophan helps to increase the production of chynurenic acid, which is actually anti-inflammatory and neuroprotective. So by eating foods that are higher in tryptophan, especially poultry, this helps to produce more chynurenic acid rather than quinolinic acid. And the chynurenic acid is neuroprotective, and this actually does help alleviate depression. To conclude, there is current evidence for an association between adherence to the MIND diet and depression. However, it is only suggestive, and the evidence currently is inconclusive. Several of the studies included in my review, particularly those involving older adult populations, did report a significant protective association, but the evidence is limited by a high risk of bias and reliance on study designs that cannot establish causality, as well as significant heterogeneity across populations and methods. Randomized controlled trials should be conducted for future research to determine if the MIND diet can actually directly reduce depression. Future research should also focus on mechanistic studies that use biomarkers to understand the diet's biological impact on the brain and body. And research should be expanded to include diverse and non-Western populations using culturally appropriate assessment tools. As far as guidance for clinical practice, currently there's insufficient evidence to recommend the MIND diet as a specific treatment for depression. However, overall, the MIND diet can be encouraged to patients as a safe and beneficial eating pattern for promoting overall health, particularly for the older adult population.